We're back to the Neil Haley Show and also the Media Giant Effect. And it's really interesting when I've talked to lots of coaches that end up losing their players and are on the shelf because of getting a concussion. They were diagnosed with a concussion, potential concussion, how long they're going to be out, which is just really a bad situation. And it really runs into big problems. And they try everything. They go and send them to a specific doctor. They're on the shelf. There's no reason. They're just going to rest. There's no real rehab. They might go to another specialist that says, you know what, he's not going to play for 6 months. And coaches are pulling their hair out because of this. And they tried everything. Well, we all know, I didn't know this till I met Dr. Charles Simkovich, that he is able to reverse concussions and CTE. And so what should coaches do? Should they just give up now because when it happens, and that's not the case, right? They have a chance to get their players to be back player ready a lot more quickly than people expected with concussions, right?
Yeah, that's true. When attacking a problem, you have to understand what's causing the problem and then how to remedy it. And you can't fix a problem until you know what the source of the problem is. Concussions have been widely misunderstood for years and years and years. And multiple different specialties have tried to address the problems from a concussion. What we do, let's look at the father of orthopedic medicine, Dr. Syriax, who's from England. He stated, his one statement sums it up. When you have a traumatic injury, the treatment must reach the source of the injury. So what specialties are out there that deal with the source of a concussion, which basically is you've had your head hit, or there's trauma to the head and brain, or the cranial bones in the brain. And this encompasses a whole syndrome of multiple things, because your eyes get involved, your circulation of the brain, of blood, circulation of CSF. And so while there's a lot of specialties that are great in remediating problems, the cranial movement therapy, which is what I was a part of researching and what we do, actually restores the normal functionality of the skull, which enables the brain to rehabilitate quicker than anything and quicker than any other modality that's out there. And it gets to the source of the problem. I'm going to give you an example of somebody, a real life coach. There's a fellow named Jose Davis. He was a basketball and football star for Kent State, and he went to Bel Air, Ohio, and was coaching their high school football team for a while. Well, they had their games on Saturdays, and he said if a kid had a concussion, they didn't see the doctor till Monday, and he said he lost them all for 4 to 6 weeks, which was basically the season. He had a boy that he referred to me because they went to traditional type of treatments, which was rest or vision therapy or vestibular therapy or physical therapy, and even in some sad cases, anti-anxiety or anti-depression medicines, which they did not have the faulty cranial bone movement restored properly, which would have healed the brain quicker. So Jose sent me a patient years ago, was injured in a game on a Saturday, drove into my office. They didn't retake the impact test, which was what tells them whether they're good enough to go back to play, until the next Thursday. Well, this fella had not played an entire season since his freshman year, and he was a senior. Sure enough, he had a concussion the first game, brought him here. He ended up getting treated. He ended up making it the entire season his senior year, never did that before. So Jose knew, listen, we get these kids remediated immediately, and he didn't have one person lose a season, because he would get them here and get them remediated, and they're not out 4, 6, 8 weeks, and they all passed the impact test, which allowed the athletic director and the trainer to say, yeah, they're cleared to play. So Jose started just putting them in his car and driving them here, and he understood the real reason why, what you need to do to help these kids heal properly. It's not a mystery. It's just doing the right thing.
It's definitely not a mystery. It's doing the right thing. And that's just amazing. What should they look out for? What are the lookouts for, especially for players, so that their performance is better? A lot of times what happens after concussions, it's harder for them to come back in a stronger way and be successful on the court, whatever, playing playing facility they're playing in. And coaches stress out saying, well, what should I do? They're not at their optimal level. Should they be ready? What kind of signs should they look at that they're clear to play? What would you say are the different things?
Well, I'll give you an example of a young girl who's in 10th grade, just left my office 10 minutes ago. She plays basketball and volleyball. Before she got referred here, she was dizzy. Any kind of physical and cognitive exertion, such as in school, would make her dizzy. It would make her nauseous. It would trigger a headache. Her vision was blurred. She was tired. A little bit of activity would make her tired. So these are the kind of things they want to look for: dizziness, increased headache, tiredness, balance issues. A lot of players will have balance issues. If they're having this with increased exertion or increased cognitive, such as in school, things, you probably have an issue. Something is not physiologically working the way it should. If we look at the way the skull moves, I'm going to look at the sphenoid bone. Your eye muscle is attached to it. So if this is compromised, if it's tilted in any way, a lot of times some eye muscles will be elongated, some will be shortened. So what does that mean in real life? Your eyes aren't going to track real well. So if you have to use your eyes a lot, such as in reading in school, you're probably going to get tired because it's hard for your eyes to move. Or it might trigger a headache because you have to work harder to move your eyes. Or you'll reread the same line over and over, or skip words when you're reading, or lose your place when you're reading. In sports, what's that mean? If you're a hockey goalie, you're going to have a heck of a time following that puck that's coming at you. If you are trying to hit a baseball, following that baseball in and hitting it, your batting average is going to drop. I had a fella from north of here ended up being drafted into the minors before his concussion. He was leading the league at Whitfield in home runs, batting average. He got a concussion. His batting average dipped to under 100. He had no home runs. His dad brought him here, and boom, he ended up, he got remediated, and he ended up leading the league in home runs. So it corrected that problem, and it was all due to eye tracking. Also, if you have an issue with the sphenoid not moving properly, you have 3 cranial nerves that pass through foramen, or openings in the sphenoid, that control eye movement. Cranial nerve 3, 4, and 6, the oculomotor, trochlear, and abducens. So in addition to an eye muscle problem, you have a nerve supply that moves the eyes that can be compromised. Plus the optic nerve passes through the sphenoid, which is what sends signals to your brain of what you're seeing. This is why a lot of people after concussions have problems with bright lights, or dizzying patterns in carpeting and things like that. Then you add to the fact that you can have what's called a sphenobasilar fault, which is a fancy word that basically says you're not getting enough brain to your blood to your midbrain. That's going to cause short-term memory issues, balance problems, hand-eye coordination. And so there's a whole bunch of things that make perfect sense when you understand the mechanics of a concussion and why this physiology of proper cranial bone movement needs to be restored, and why it's so successful, and how you can help these people who have suffered from concussions.
It's wow. It's a wow factor to think about, specifically what's happening with concussions. Let me jump to this other point. The signs you talked about, the signs of concussions, the different things. What do you do first when the injury occurs and you think that that player has a concussion? What are your recommendations?
See if their eyes are reacting and their pupils are dilating, or if they're fixed. And that's easy enough. A lot of people say, well, I don't have a pen light. Well, you cover both of their eyes in light, and you remove your eye, and the pupil should be reacting. See if they're reacting. See if their balance is off, if they can walk. A lot of them will actually look confused. Ask questions of things they should know, like days of the week and months. When was your birthday? If there's confusion, if there's any sign of confusion, or even if they're saying, listen, my head's hurting, or if they're stumbling, and the eyes will get glazed over. These are things, the immediate things you can look for, and I would not put them back into play. I mean, this is the quick check, and that will tell the story. If these symptoms continue, then there are some cases where you need to do, the first thing would be a CT scan, because that sees a gross bleed. If it continues longer, then you do an MRI that sees a finer bleed, and there's a bunch of diagnostics. Well, most of those are the big things. they can't see a concussion on CT or MRI, but it sees any pathology, if there's a bleed or a fracture or anything pathological like a tumor or a Chiari or things like that. And then you can rule that out. You can't see a concussion on scan, but you can at least rule out any danger that would be life-threatening to this person.
All right. This is such great information. The best place for people to go is where?
Simkovich concussioninstitute.com.
All right. You're listening and watching the Neil Haley Show, and we'll be back in just a moment.